at the University of York, and will be talking to us about her research project exploring the role of community in the lives of parents with learning disabilities, and lots more, I'm sure, Hannah. Yeah, so I'll hand over to you. Thank you.
All right, thanks, Sharon. I'm just going to share my screen because it's got my slides on it. Hopefully this will work okay. To share. Is that showing up all right?
Okay. Great, thank you.
Okay, so hopefully this will work okay. Right, yes, so I'm here today to talk about a National Institute for Health and Care Research funded project that I recently completed with some colleagues of mine at the University of York, alongside York People First, which is our local self-advocacy group for people with learning difficulties. So essentially, I'm just going to talk here about the project and highlight some of our main findings for you, and some of the kind of messages or thoughts that we had about our findings and how they could relate to organisations that work with parents with learning disabilities, particularly within community settings. So first, I'm just going to say something quickly about what our research is about. So essentially, the interest in our research project was sparked by thinking about, the high levels of parents with learning disabilities who often are not able to experience family life because having children, having interventions by children's services, often ending with children being placed into care. And one of the things that we came to this project with, and York People First particularly were interested in supporting us in finding out, was how can we think about communities as a way of supporting parents with learning disabilities to enable them to have good family life and to enable them to experience family life, based on the truism, I suppose, that being a parent is a community endeavour. A lot of the time, it takes a village to raise a child, as they say. So we know from a lot of research on people with learning disabilities and on parents specifically with learning disabilities that they can struggle to build social networks, and they can struggle to form relationships with others in their communities. They're often highly socially isolated, which can make being a parent very difficult. So we started from that point of thinking about community, and then specifically we wanted to find out whether a particular approach to community development, something called asset-based approaches, could help parents. And the reason we focused on asset-based approaches is because this is a model that's been taken up in the UK in recent years, particularly within local authorities and within the NHS, as a way of supporting people and groups and communities to access the communities, to be part of their communities, to have those kinds of supportive relationships. So here I've just put a very quick synopsis. Obviously, asset-based approaches, it's quite a complex model, and it's very difficult to define. It can actually be very fuzzy, as often these things are. So I'm not going to go into it in detail, but just to highlight the way that we define thinking about asset-based approaches, that they are community-led. So they're based within the community, they're led by members of the community, they're strengths focused, so they're focusing on what members of a community, a particular community, can bring in terms of supporting themselves and supporting others in their community. And that leads to a focus on social networks, and leads to a focus on co-production. So members of asset-based groups being actively involved in driving the agenda for whatever it is, whatever project it is that they're involved within. So the questions that we asked broadly for this project were thinking firstly, how do parents with learning disabilities actually experience their communities? Like I said, a lot of the time the academic discussion around parents is that they don't really have community, and that they experience significant levels of loneliness and social isolation. But we wanted to dig into that a bit and to find out a little bit more about what parents' experiences are. We also wanted to find out what might be the barriers for parents with learning disabilities, what makes it hard for them to be involved in their communities, and finally, what might be the potential for asset-based approaches to support parents to be part of their communities, to be active participants and citizens, but also, like I said, to maintain and successfully maintain family life. So going on to how we actually carried out the research, there's a lot more back-end stuff here, but again, I'm not going to go into it in too much detail. We carried out this project during COVID-19, so our original plans changed very significantly. We ended up doing a lot of this data collection online. But what that did mean was that we shifted from being focused on a very local kind of area. We were originally going to look in just Yorkshire, to actually being able to interview parents and professionals from around the UK. Particularly, we focused on England and Scotland, and just followed the leads there in terms of the people that we included. So we talked to 33 professionals, and these were mainly practitioners who worked within the NHS, within local authorities, within voluntary sector organisations, who knew about asset-based approaches, or about parents with learning disabilities, or in some cases both. We also interviewed 13 parents, and we held 2 interviews with parents about various aspects of their lives and their communities, and what family life was like for them, what community life was like for them, and what they would like to see in terms of thinking about community support. And then to end the project, we held 4 focus groups with practitioners, which was a way of kind of discussing our findings and seeking support from practitioners in thinking about how those findings might apply to practice. So when we talk about community, again, it's not something that's easily defined. When we think about community, it can often be a very taken for granted concept. But there are different ways of thinking about community. And for the parents we talked to, we kind of found when we were talking to them about community, it's split into 3 different ways of thinking. So firstly, communities of place. So this is very much thinking about community as something around a geographical location for parents, where they live, their immediate environment, their neighbourhood, where they went, where they didn't go for various reasons, how they got about their communities, their local kind of neighbourhoods. Parents also talked about community in relation to networks, social networks and relationships. So the people who were important in their lives for different reasons, and the kinds of relationships they had, sometimes positive, sometimes negative, sometimes a mixture of the two. And also finally, communities of interest. And what we meant by this was when parents were talking about, for example, groups that they belong to, whether they be specific kind of parents with learning disabilities groups, which some of them did belong to, kind of mutual support groups, through to things like toddler groups, through to kind of domestic abuse support type groups, church groups as well. So a range of groups really, and organisations, either based on need, so things around domestic abuse or things around support for parenting, or based on interest broadly, things like belonging to a church, things like belonging to a local social group, or kind of a mum and toddler group, those kinds of things. So just to kind of very briefly overview what we learnt, and one of the things that we learnt about parents is that actually, although they often did talk about social isolation and loneliness, they also did talk about being part of their communities in different ways, and that sometimes countered that picture of parents as being kind of completely on their own. So thinking about relationships, for example, this parent here is talking about her friendship groups, and the key thing I want to highlight here is the mutual the mutual nature of those friendships. So not just about parents receiving social support, but also feeling that they were able to actively contribute to the lives of people in their networks as well. So kind of moving away from that model of just being a kind of recipient of care, I suppose. In relation to communities of place, there is some overlap, as you can imagine, between some of these categories. So we put neighbours in communities of place, but they could also belong in relationships. It was a bit tricky at times to make those distinctions. But this parent here, for example, talked about moving, and lots of the parents we talked to actually had moved for different reasons. Some because, for example, they'd experienced difficulties in their neighbourhood and then they'd requested to move through social housing because of those difficulties, relational difficulties. And this parent here kind of contrasted the negative experiences that had previously with their neighbours to their neighbour here, who provided a great deal of support to them, who they were very close to. And finally, communities of interest. So again, this quote highlights really what parents talked about when they talked about what they got from communities of interest. And this parent here is talking about a specialist group, parents with learning disabilities, and again, accentuating that kind of mutual support that these groups provided. You know, the ability to come with issues and talk about them in a group setting, but also support others as well. So moving on to why community might be difficult for parents. So I've talked there about the positive ways that parents approach the communities, but obviously parents did talk significantly about the barriers as well. And here we highlighted sort of three ways of thinking about that. So in relation to communities of place, it was often around issues around transport, kind of having to use public transport, which wasn't often accessible or sometimes wasn't accessible. Accessibility of place as well, particularly for parents who had multiple disabilities of various kinds. Parents who'd had kind of traumatic experiences within community settings that then meant that they were frightened to go out and about, particularly by themselves, and alongside that, perceptions of danger. Barriers to social relationships I'm going to talk about in more detail next, so I won't talk about that now. Barriers to communities of interest. This was often related to, for example, parents wanting to access things like parent and toddler groups, for example, but them not being available or not being especially accessible, particularly when it comes to things like the language used, ability to actually understand what was in an area, things like how a group might be advertised or not. Parents actually knew what was around and about for them. Feeling also that their children's needs might not be catered for. This was particularly the case because almost all the parents we talked to, their children also had a learning disability of some kind, in the sense that they might go to a group where children's kinds of needs related to that weren't responded to. Also, kind of more specialist groups in particular, parents often talked about having a fear of getting involved because it might trigger the involvement of services, statutory services, kind of children's services, and having a real fear of that kind of involvement. And also feeling that they just didn't fit within groups that might be part of their community for different reasons. So these are the kinds of barriers that parents discussed, and I'm going to talk specifically now just about barriers to social relationships. So parents and professionals, the practitioners we talked to, both discussed significantly issues related to stigma and exclusion. And what we found was that stigma could often be have a dual dimension for parents, related firstly to their learning disability and secondly to having an involvement with services. And that kind of the interaction between those two kinds of forms of stigma could make it quite difficult for parents to feel that they could be open in relationships with others, that they could trust others. you know, so for example, this parent here talks about the learning disability, saying that, you know, it really created a distance. She didn't feel that she was able to form relationships because people weren't really interested, of the local parents. And this professional here is saying, you know, it's very difficult to kind of get to know people because, you know, it's really hard to talk about things, you know, if you have involvement with children's services, and that could also create a barrier for parents, creating kind of open and honest relationships in their community. A second barrier that was highlighted was trauma and the impact of trauma on parents' lives. So all of the parents that we talked to, when they talked about their history, talked about very difficult experiences that they had had, relational experiences, often going back to childhood, of being bullied, of being abused in different ways, either within the family home or within school settings, moving into adulthood and having experiencing abusive relationships of different kinds, and carrying that with them made it very, very difficult, as you can imagine, to create relationships with other people. So this mum that I spoke to here, you know, had a real fear of men, to the extent that she would be frightened just coming across men out and about within her local community, and that was because of experiences that she'd had throughout her life, and also the effect of, so you got there, the effect of trauma on mental health and the anxiety that can lead to for parents, but also, like I said, the effect of trauma on relationships, of not being able to feel that those relationships are going to be successful. Kind of following on from that, when parents did talk about social isolation, it was often in the context of the trauma that they'd experienced within their life, in the sense of kind of feeling that actually they didn't feel able to be part of community life because of their fear and anxiety around making relationships. And that could lead to feeling like life was quite restricted, and in terms of what their social networks consisted of. So this mum here, you know, was saying, if it wasn't for my immediate family, you know, I really wouldn't see anybody apart from those kind of brief encounters that you have within the community settings. And this practitioner also highlighted that, particularly for parents who'd experienced kind of institutions as children and young people, accessing kind of local neighbourhood-based community could be quite difficult, because you know, it's that sense of kind of belonging to a community, to a group, to knowing other people around and about that you've grown up with. That could be quite tricky. So moving on now to thinking about asset-based approaches. So when we looked at asset-based approaches that work with parents, we actually kind of struggled really to find organisations that really explicitly said that they used an asset-based approach with parents. And it did involve a little bit of digging on our part to kind of figure out what that actually meant, you know, in terms of thinking about asset-based. There isn't much out there in the literature either on thinking about this approach. And I think that's because asset-based approaches are often used within kind of general populations. So they don't tend to be applied necessarily to specialist groups in the same way, or to kind of particular groups within a population within the same way. But some of the groups that we did talk to, the organisations and practitioners we talked to, kind of worked within particular settings that did use what we applied as asset-based principles. So, for example, we spoke to kind of local area coordination groups, often based within local authorities, sometimes within the voluntary sector, who you know, had kind of specialist knowledge working with parents. One of those local area coordination groups had a specialist worker that worked with parents with learning disabilities. And so they had that kind of expertise. They could have that expertise with parents, but also have the asset-based kind of principles that underpin the work that they were doing. We also talk to Shared Lives organisations. So I don't know if you've come across Shared Lives. I'm sure some of you have, some of you may not. But essentially what they are is it's an organisation which supports people with various vulnerabilities, adults, to kind of live with members of the community and have support through living with kind of people who can provide them support with things like life skills, provide them with that kind of home life, basically, that can often be lacking or missing. And again, those Shared Lives is a general model, so it kind of supports people with all kinds of different vulnerabilities. We did speak to some Shared Lives groups which supported parents and had experience to support parents with learning disabilities to live within family homes, often with their children, as a response to, for example, children's services involvement and concern, being able to live in this situation where they and their child were supported. They were supported to be a parent through living within a family home. And again, Shared Lives takes very much an asset-based approach. It's very much kind of driven by the people who provide their kind of families, open up their families and their homes to people to come and live with them. And finally, the final kind of group that we spoke to were peer support groups. So these were organisations, voluntary organisations that often ran peer support groups for parents with learning disabilities, which again were very self-directed, were focused on advocacy, were focused on mutual support. And when we talked to those groups and those practitioners, we found that they supported parents in a number of ways. One was to build their social networks, to help them kind of develop that kind of sense of social capital of people that they could reach out to, who could also come to them if they needed support. To develop confidence in their own strengths, because parents with learning disabilities are often severely lacking in confidence as an individual and as a parent, lacking the sense that they can be a good parent. So building up that sense of confidence and agency for parents to feel that they were able to be a good parent. And also supporting parents to be active in terms of working within their communities, things like related more to like advocacy, for example, and again like an education. So parents, for example, going into different organisations to talk about being a parent with learning disability and what that means, and kind of supporting professionals to understand that. So again, I'm just going to focus very quickly on the kind of social network aspect of that, because I don't have time to cover all of this. And just here again, there's 3 quotes here about different ways that asset-based approaches worked with parents to build social networks. So here, the first one, the professionals talking about, supporting a dad who kind of linked up with another dad and felt like he wasn't on his own. They were able to kind of create a mutual kind of support system. Secondly, the importance within these organisations of building long-lasting relationships with parents, which can be very difficult, I think, for professionals to do for various reasons, related to time scales, related to what the kind of aim or the focus of kind of working with a parent is. But within these organisations, actually places like local area coordination, Shared Lives, they were very much based on long-standing and ongoing relationships with parents over a number of years. Maybe not necessarily the same professional for obvious reasons, but the same organisation, the same group of professionals who got to know a parent and were able to support them over a long period of time, and the importance of that, in terms of bonds, but also in terms of like support at different kind of developmental stages of parenting. And finally, supporting communities. These organisations often support communities to become more inclusive in different ways. So, for example, setting up groups that were open to people from all kinds of backgrounds that parents would come along to, but they weren't just for parents with learning disabilities. That's one example of that. So thinking about the benefits of asset-based approaches in relation to social networks, touched on these, but one of these is that parents were able to get advice and support, and that they're able to form those really important mutually beneficial relationships, which had a multitude of benefits, in relation to parents feeling that they were contributing, feeling part of a community, building their kind of sense of confidence in what they could bring as well, and being seen as a whole person and not just as a problem or an issue that needed to be solved. So there's obviously challenges to asset-based approaches. It's not kind of all rainbows and sunshine, unfortunately. Those challenges to community life parents bring with them, and that can make it very tricky for organisations to support parents effectively for various reasons. And there are specific challenges to asset-based approaches as well beyond that. So asset-based approaches should be based on co-production, but that isn't always an easy thing to achieve. You know, co-production can be very difficult in terms of power dynamics, also in terms of thinking about moving beyond kind of tokenistic approaches to genuinely including people in service delivery, design, decision making. Overcoming parents' distrust as well, it was a significant challenge to practitioners. And also practitioners within particularly voluntary sector organisations felt that they really needed to counter this focus on risk that could often be based in statutory services. So I know I've just gone a bit over time, and I'm really sorry. I just realised I know I had 10 minutes for Q&A, so I'll just be really quick. So using asset-based approaches with parents with learning disabilities, really it's about kind of supporting parents to form those stronger relationships in different ways. So connecting people to groups, services and activities, you know, going along with parents to groups, which practitioners often talked about, to kind of provide a gateway for them, developing various forms of peer group support, considering what services can do to enable long-term relationships with supported professionals. Thinking about welcoming communities as well, how to develop that. So involving parents in the creation of new groups and considering activity-based groups that have a purpose that parents and other community members can focus on. And focusing on the accessibility of resources as well is really important. And also adapting services, so integrating that kind of focus on trauma-informed practice because of the history that parents come with. Thinking about advocacy as a key part of asset-based approaches, particularly in relation to the context of statutory involvement, and thinking systemically about the issues that parents face, and connecting up the challenges that parents face so we can better identify opportunities to support parents with learning disabilities. So that is my presentation. So it's a bit of a whistle-stop tour there. There's a lot more in the report. So if you're interested, there's a link here to the report. And if you'd like to get in touch with me, my email is here. So thank you, everyone.
Thank you, Hannah. Any questions for Hannah at all? No? Okay, you can pop them in the chat bar. And I don't know, Hannah, if you're hanging around or if you're disappearing, whichever way, if there are questions that come through, we can send them on to you and maybe get some answers if that's okay with you.
Yeah, that's absolutely fine.
Yeah. Okay. Just one last call then before I introduce Sam. No more questions. Just need you to stop sharing. Is that okay?
Oh yeah, sorry. Yeah.
No, hopefully it's given people time to write down the details there, but we can also send them out as well. Yeah, right. Lovely. Thank you. Thanks, Hannah. Okay, can I introduce Sam Williams next? And Sam's Policy and Communication Manager for Learning Disability Wales. And Sam will be talking to us about getting the right support and the challenges faced by parents with learning disabilities. So Sam, over to you.
Hi, everyone. Thanks for inviting me. Right, I'm going to try and share my screen now. Oh, I don't think that's right. Hang on a minute.
Yes, we can see it, Sam.
Yeah, I don't think that's the right way. Hang on a second. Right, this is better. Okay. Okay, is that okay?
It's great, thank you.
Lovely, thanks. So I'm Sam Williams. I'm the Policy and Communications Manager for Learning Disability Wales. I've worked for Learning Disability Wales for about 15 years in various policy and communications roles. And one of the areas that I've specialised in, policy areas for several years now, is parents with a learning disability. I'm just going to sort of, just in case anyone doesn't know who Learning Disability Wales are or what we do. So we want Wales to be the best country in the world for people with a learning disability to live, learn, love and work. And we do this by working in partnership with other organisations, including third sector. We have members who are third sector support providers. We work with Welsh Government and local authorities. We offer training and events. We provide an information service, and obviously we do a lot of campaigning around influencing policy. And actually, parents with a learning disability is something that we have been campaigning on for many, many years, probably at least 25 years now. We've done kind of work on this. I previously worked on a project, the Working Together with Parents Network, which is headed up by the Nora Fry Institute at Bristol University. And it was a partnership project, and we were sort of the Wales partner. So I did a lot of work then around, we set up a network in Wales of parent groups of parents with a learning disability to listen to their stories and to use that information to try and shape policy and to campaign for the new guidance that was mentioned by Ruth at the start this morning. So again, this is one of the downsides of being this late in the day is that a lot of the stuff that I'm planning to cover has probably already been covered today, because I have been kind of dipping out today, so apologies for that. I know this has already been covered, but so MenCap says that a learning disability is a reduced intellectual ability and difficulty with everyday activities, for example, household tasks, socialising or managing money, which affects someone for their whole of their life. So basically, what does that mean? So people with a learning disability often find it harder to learn certain life skills, for example, communication, personal care, reading, managing money, making friends, etc. But as someone said earlier on, it doesn't mean that they can't learn. It just means that it might take them a bit longer, and they may learn in a different way. So a few facts. So people with a learning disability die on average 16 years younger than the general population. 8 out of 10 have difficulty reading. It's estimated roughly that between 40 and 60% of parents with a learning disability have their children taken into care. Only 17% of adults with a learning disability are in paid work, and almost 1 in 3 young people with a learning disability spends less than 1 hour outside their home on a typical Saturday. Now, health inequalities, for example, around why do people with a learning disability die younger? There are lots of, obviously it's a very complicated issue, but there are lots of reasons. For example, lack of information in an accessible format, reasonable adjustments that we've heard a lot about today, and it's something that I'm going to talk about as well. Lack of understanding and awareness, excuse me, communication issues, different demonstrations of symptoms of pain, for example, or symptoms being blamed on the learning disability, and again, diagnostic overshadowing, which is something, again, I'm going to talk a bit more about later on. There's also, around the employment, there's a lack of specialist employment support and job coaches. There's low aspirations or expectations that are ever discussed with people with a learning disability. There's, fear around losing benefits, lack of awareness. There's again, it's a complicated issue, and the social isolation, which was just mentioned in the last presentation. There's a lack of support. There's issues around hate crime and mate crime, but also people with a learning disability often rely on support to be able to go out, and socialise, and they're affected by staff rotas, by the fact that often their staff finish, for example, at 9 o'clock, which is why we at Learning Disability Wales have something called the Gig Buddies Cymru project, which is a befriending service that matches people with a learning disability with volunteers with a similar interest, so that they can go out to gigs. Because again, we recognise that there's a lot of issues around social isolation. There's also sometimes within services, the whole risk aversion and risk avoidance rather than risk management, and not letting people take risks and not letting people do things that might be deemed as risky. But all of these things can obviously result in mental health problems and an increased dependency on service, poor physical health, So social isolation and loneliness, as we know, it is very, very damaging to people. So around the issue of mental health, people with a learning disability can be more likely to experience poor mental health. And some studies suggest that the rate of mental health problems in people with a learning disability can be up to double that of the general population. But the problem is that actually people with a learning disability often find it much harder to get a mental health diagnosis and then therefore the support they need. And again, there's this issue around diagnostic overshadowing. For example, their behaviour might often just be put down to their learning disability, not the fact that actually they're showing signs of a mental health problem. Often they find it very difficult to have anyone to listen to them or be taken seriously about their own mental health, or for example that of their children. And that's something that we came across a lot with the parents with a learning disability that we spoke to, is that quite a few of them suspected from an early age that their child had some form of learning disability or neurodivergence. But trying to get that diagnosis was incredibly difficult because everything was put down to the parents' learning disability and their supposed poor parenting, rather than the fact that the child's behaviour was actually down to the fact that there was an issue. And often it wasn't until the child was taken into care and then foster parents would then say, actually, I think there might be an issue here. I think this child might have some form of learning disability, but the parent with a learning disability was not taken seriously when they suggested that there was a problem. And it also might be just a simple fact that they're not able to communicate or explain their symptoms and their feelings. And also their symptoms might manifest in a different way to people who don't have a learning disability, or and neurodivergent people and people with a learning disability. Often their symptoms might be different to neurotypical people. So there's the difficulties of getting a diagnosis, but then there's also problems with actually, if you get a diagnosis, of accessing support. For example, we often hear that generic mental health services don't feel that they have the knowledge and skills to work with people with a learning disability who have a mental health problem as well. But the specialist services often just either are not available, or they have such long waiting lists that people, are just waiting for such a long time that they just never get the right support. And again, this has been touched on today, is that some of the barriers to equality in our society, and that I think we've, over the years, we've got much better at identifying physical accessibility and identifying ways to overcome that, using the social model and understanding that it's society that places barriers on people's lives, not the person's impairment. But for people with a learning disability, the barriers can often be very different and they're nowhere near as obvious. So, for example, just not being able to understand what your GP or social worker is telling you, not being able to read the letter from your bank or council or hospital, not understanding how to keep yourself safe online or in the community, just not being able to communicate with the bus driver or the shop assistant, all these things that sometimes then, are real barriers to people being able to access the community and live a full life. And people who are deemed as having challenging behaviour face even more discrimination and social exclusion. So, for example, that they find that they're not allowed to go out in the community, or if they do, they have to have, say, 2-to-1 support, so they never have any sort of independence. They're far more likely to be subjected to restrictive practices, including physical or chemical restraint, and often they risk ending up in assessment and treatment units. So what sort of things can help with overcoming the barriers? Again, we've heard about most of these already today. Awareness and understanding of specific needs, reasonable adjustments, so important, accessible communication, specialist support, and advocacy. So parents with a learning disability, as I mentioned earlier, there are estimates that between 40 and 60% have their children taken into care. But as Ruth said this morning, it's very difficult to get very accurate statistics on this because of the different ways that parents with a learning disability are identified, and often they're not identified. So it is very much an estimate. Lack of good quality sex and relationships education. This is a real issue. And lack of staff training, awareness and understanding, lack of specialist support or reasonable adjustments to access services, and lack of specialist advocacy. And we found that actually mothers with a learning disability were particularly disadvantaged because there's often still in today's society this general assumption that mothers are the main caregivers. So in a couple, if only the father has a learning disability, not the mother, there's actually a lower risk of the child being taken into care than if the mother has a learning disability but the father doesn't. Because women with a learning disability as well are also, unfortunately, at higher risk of being targeted by men with a history of domestic violence and possibly even child abuse. And obviously this increases the risk of their children being taken away. And that's often what we found in lots of the parents we were talking to. The reason their children were taken away was not necessarily due to their parenting skills. It was the fact that they were deemed as not being able to keep their child safe. Now, lack of understanding and awareness around abusive relationships can be a significant factor, particularly for mothers with a learning disability. Many people with a learning disability have experienced some form of abuse on a regular basis throughout their lives, from childhood bullying to being shouted at in the street, or even physical assault. So in these circumstances, abuse has simply become an accepted part of their daily lives. Their threshold for what abuse is much higher than most of us because it's part of their lives. So it's very difficult then for them to then recognise an abusive relationship that they're maybe, a part of and experiencing. And as mentioned before, they also have often very restricted social circles with few friends or relationships outside their immediate family or their carers. And this makes them more vulnerable to abuse from people who might want to take advantage of them, for example, financially, sexually, or emotionally, which is sometimes called mate crime. And people with a learning disability often believe that these individuals genuinely care about them and very reluctant to give up these relationships, even if they're being advised by social workers that they're at risk of having their children removed, because that's often the only form of support they have is that relationship. So again, this is a big issue then with having their children removed. And also they quite often have very little knowledge or understanding of paedophilia. Because it's never explained to them. It's never something that comes up in their sex education, so they don't know how to keep their children safe from abuse. One example we had was an advocate told me about a mother with a learning disability that she'd been supporting for some time. Now, the mother had been sexually abused by her own father, and she had 2 children herself who were on that risk register, a daughter and her son. And she allowed her parents to look after her son. And the advocate was quite shocked by this because she knew of her history of abuse, and obviously social workers were very concerned by this. When the advocate spoke to the mother about this and asked her why she would do that, why would she let her father look after her son, she was very confused, and she said, "But he's a boy." No one had ever explained to her that boys could be sexually abused. She only thought it ever happened to girls because no one had ever bothered to explain that to her. So again, this, all these things contribute to how then people with a learning disability are deemed as putting their children at risk because they simply don't have that information and that's never been explained to them. So they're not able to safely keep their children safe. So these are some quotes from some of the parents that I've met over the years in different groups about some of the challenges they face. I just feel helpless. No one is listening to me. Whatever I do isn't good enough. We need to know what our rights are. We do as we are asked, but the goalposts keep moving. I felt pressured into sterilisation as I was told, any child you have will be immediately taken from you. My child was taken away from me at the hospital and I'm only allowed supervised contact. I was never given a chance or any training to help me keep my child. I was simply judged as not capable. My ex is a heavy drinker, is violent and has been to prison, yet he is allowed contact with our child 4 days a week from Monday to Thursday. And this is something we hear quite a lot, actually. I think, unfortunately, social workers are given quite a lot of training around working with parents with substance misuse, but almost nothing around working with parents with a learning disability. When professionals talk to you, the language they use is often hard to understand with too many big words, especially when doing assessments. My son and I are both terrified of social worker visits as we're always afraid of saying the wrong thing. Parents with a learning disability need support, not judgment. So what do parents with a learning disability need? Good quality sex and relationships education and ongoing training. As I mentioned, something that's still very lacking often in lots of people with a learning disability. They simply don't, they're told, oh, you don't need to know this in school. And often any sex education they do receive tends to focus almost entirely how to avoid getting pregnant and never on choosing to start a family or how to look after children. This lack of education affects their knowledge and understanding of important issues such as consent, abuse, healthy relationships, pregnancy, childcare, etc. And this in turn contributes to their increased risk of unplanned pregnancies, being in abusive relationships and potentially having their children taken into care. So early intervention and support is so important. The parents' needs must be identified and assessed as the earliest possible stage, preferably before pregnancy, but at least during, because often what happens, it's not until the mother gives birth that suddenly someone sort of says, oh, I think there's something going on here. I don't think this, I think this parent might have a learning disability. But at that point, they've already missed out on 9 months when they could have been developing those skills, enabling them to look after their child. Accessible communication, as I said, parents with a learning disability often have low literacy skills and therefore need an information in an alternative format such as easy read, Makaton, pictures, videos. There is no one size fits all. It is about making sure that you're understanding the best way to communicate with that parent. Avoiding jargon, avoiding idioms, plenty of reinforcement, and making sure that reflection, making sure that they understand. Don't just say, do you understand? Because they will just say yes, because who wouldn't? Because it's embarrassing to admit you don't understand. Plus they think if they say they don't understand, they'll be marked down and their child will be taken away. So again, it's about asking the right questions to make sure that they've understood. Children, joint working, so children's and adult services, health, whatever, all need to work together to support the family. Specially adapted support, they might need extra time, different ways of learning, visual aids, and parenting programs. Often parents with learning disability are sent on generic parenting programs that simply don't work for them because they're not accessible. They need to be adapted to the specific needs, and it might be role play, it might be visual prompts, it might be regular reinforcement. There's different ways to support parents with a learning disability. Specialist advocacy, especially to attend court, and this is so important. We're hearing more and more now local authorities are only commissioning generic advocacy, but that's not particularly for these groups of parents. They need specialist advocates who understand working with someone with a learning disability, but also understand the child protection system, because we're hearing about people being given an advocate who might be actually a young person's advocate or an older person's advocate, but they're just a generic advocacy service. But then they're told, oh, we can't go to court with you because that's outside our remit. But that's the most important time. That's when the parent really needs that support. So again, advocacy is so important. And there's also self-advocacy is another really important way that parents can get support, whether that's through people first groups, because it promotes confidence and helps them to grow their own self-esteem, but it also offers that kind of peer support and advice. And ongoing support, because while some parents with a learning disability might only need support for a relatively short period of time, most will need some form of ongoing support. Because obviously they might be able to learn new things, but their impairment does not go away, and therefore they might need assistance with daily living for the rest of their lives, especially as new situations arise. So, and also, children, their needs change over time. So when a child starts school, for example, there's a whole new set of issues to deal with. And when a child, becomes a teenager, again, there might be times in that child's life when the parent needs extra support. But most of all, parents with a learning disability need to be given the opportunity to demonstrate that they can be good enough parents. They need to be listened to, shown respect, and not be just written off due to misconceptions and social stigma. With the right support, parents with a learning disability can raise happy, healthy children in a safe and loving family environment. So what might help? Again, this is the views of some of the parents that I've worked with. Someone to talk to who will really listen. Someone to explain things in language we can understand. Someone to be on my side for once. And this is the views of some of the advocates that we've worked with about what might help. So training for professionals should involve parents with real life experience. Listening to parents' stories and experiences will hopefully help professionals to have a better understanding. Offer ongoing support where there are difficulties. Don't criticise. Show parents what they're doing wrong so they can try and get it right. I'm just going to touch now on parental mental health and say parents with a learning disability are likely to be extremely anxious and stressed. Pregnant mothers might not understand what's happening to their bodies. They might fear the birth or any form of medical intervention. They might really worry about having their children taken away because they're likely to understand that and realise that that's an issue, particularly that they've already had other children taken away previously. They're likely to feel like they're really under a microscope because everything they do is being watched all the time. They're constantly living in fear of doing or saying the wrong thing, and all of that is hugely stressful and has a big impact on their mental health. They're less likely to have circles of support, especially friends or other parents. And that's been touched upon earlier today as well. They might find it hard to access support groups, including parent and child classes. Again, the previous presentation talked about this. Many groups, they are not accessible for various reasons, or very welcoming for parents with a learning disability, particularly if they've got communication difficulties. And often the parents might be worried about be seen as different, or as I say, the whole stigma around having a learning disability. They might not trust professionals. They might have had previous bad experiences, especially if they've previously been in care themselves or if they've had children taken away in the past. They might fear medical interventions, for example, injections and blood tests. So again, there's issues around trusting professionals. And particularly, as I say, in the childcare system, they think that they're worried that everyone's spying on them. I even had this myself. It took me a long time to get the trust of the parents because they were worried that I was going to feed back to children's services about them. They might find it difficult to ask for help, and actually they don't know who to ask. They don't know what support's available, or even that they need any help with them. They might not recognise that they're struggling with their mental health. They're worried that if they admit that they've got a problem with their mental health, that would be viewed negatively by social services. And again, it'll just build up that evidence of the fact that, they just can't cope. So training for professionals, I've just sort of covered some of the, just listed some of the things here that are important, for any training. But any professional who works with families should have an awareness, understanding of the needs of people with a learning disability. Staff providing direct support to families or carrying out assessment should have more in-depth training on how to support parents with a learning disability. And training should be provided by learning disability experts, and it should involve people with a learning disability themselves in some way. For example, the Paul Ridge training that was mentioned earlier. I just again wanted to touch on this. I know that Ruth mentioned it. So England and Scotland have had guidance on supporting parents with a learning disability for many years, and this is something that we campaigned on at Learning Disability Wales for so long, because we felt that we were really behind on this, that we were having social workers come to us and asking, where's the guidance? I've got this family, I think the parents got a learning disability, I don't know where to go. And we would have to point them to the guidance in England because we didn't have any. So we are really happy that finally Wales has got guidance, and it is available on the Welsh Government website. And although it's aimed at social workers, it's very relevant, I think, to any professionals who are working with parents with a learning disability, and also whether the parent has a diagnosis or not, because I think that's very important. I mentioned in the chat earlier, there's this big gap between the number of children who have some form of additional learning needs, and often, previously were statemented, and then there's this massive drop in numbers when it gets to adult services, because adults then often don't meet the criteria to get support until suddenly they're pregnant or they have a baby, and suddenly, oh, hang on a minute, what's going on here? We think this parent has a learning disability. Up until that point, they've not qualified for any sort of support. So so there is this kind of big gap. And that's why the guidance then is really important. You don't, it doesn't matter if the parent has a diagnosis or not. If you suspect that they have a learning disability, then the guidance, should be used to help. Sorry, that's a bit of a whistle stop tour, but please, do get in touch. I've put some in the chat as well, but there's some really good resources on our website. We have a section under resources for parents with a learning disability, and there's different pieces of examples there. There's some easy read information, there's research, there's various other organisations that might be useful, so please do have a look. And the Working Together with Parents Network, if you don't already know about it, I would, as professionals, I would sign up to that network, and there's loads of information on there, and that they send out as well.
Thank you so much, Sam. That's great. Any questions for Sam at all? Any reflections? I'm going to sit in the silence. No. Go on, Marie. You look as if you were going to say something. Oh, Gemma. Go on. Oh, no, Joe first. Go on, Joe.
Sorry, I just gate crashed the end of your presentation here, Sam, so I don't know whether you've already covered this, but I'm just wondering, with the uncertain times, Sam, and apologies if you've already covered this, what are your fears for the support you give the young people you work with as parents for the future? I'm just wondering, I mean, that's like asking you to predict the future, you know what I mean? And I appreciate that, but what concerns do you have as Learning Disability Wales?
Yeah, I mean, thanks, Joe. I mean, funding in this area has been notoriously difficult. I mean, I remember when I started working on the project, there were a number of advocacy organisations who had specialist projects around supporting with parents with a learning disability. I'm pretty sure they've virtually all gone now. I think the only group that I know of still is Vale Parents Group, and it was already quite limited. And there was also a really great project called the Umbrella Project, which is Action for Children, that was in Cardiff and the Vale, and that again lost funding. We tried to campaign for them to keep their funding. It was a fantastic project, and that's the thing. It's such difficult times, and that's again with the reason why the specialist advocacy is not there, because again local authorities are just now going for the cheapest advocacy contract, and that's often just it's all very cutthroat, and that's often then a generic one that simply doesn't have that ability to support those individuals. They don't have the skills, they don't understand the child protection process. They're not able to support those parents in court, and this is like the most important. Can you imagine that the thought of having your child taken away, the most stressful situation you can ever possibly be in? I think as a parent, you're in that court, you don't understand a word of what's being said, but you know that these people are talking about taking your child away, and you don't understand what's going on, and there's no one there to kind of really explain it or help you or whatever. It must be absolutely terrifying. It really must. And as I say, the lack of funding and support in this area is really, really worrying. And also the other thing is the support afterwards. Once a child is taken away, there's nothing. There is no, the grief, the what these parents go through, and it goes on forever. As I say, I've met parents 15, 20 years on who say to me, can you help me get my child back? It's never really been explained to them that that's never going to happen, that they're never going to get their child back and whatever, because there's simply no support when they've gone through the most awful experience of having their child taken away, because there just isn't. There's nothing there.
Okay, thank you. Gemma?
Yeah, I just wanted to say, made me reflect, especially on one case that's been going on for a while. But a lot of points, yeah, I mean, it's very complex as well. It's, like we've got a mum who doesn't think she's got learning difficulties, but the social worker is really, really, really good. We've got them off child protection, but it's a pattern as well, isn't it? They're vulnerable. They attract the wrong type of relationships. Then, this case in particular, I think she's got PTSD, but I think there's more to it, and